Good morning. It is 5:25 on Friday, March 9th, and it is very early, but I have my coffee, and I wanted to take a minute and thank you so much for your support. I am more than halfway to my $1,000 fundraising goal, and I'm so excited because I know that we can get there by the American Heart Association's Heart Mini Marathon here in Cincinnati on March 18th. We can absolutely reach that goal. So, that being said, if you watched my video from Thursday, you know that I am walking in the mini marathon in honor of my dad, who suffered a stroke 10 years ago. But most of the people who have donated to my fundraising campaign over the last couple of days have done so not only because they know my dad, but also because their families have been very directly impacted by heart disease in particular. I found a couple of interesting statistics on the American Heart Association's website this morning. And the AHA identifies, 5 criteria for ideal cardiovascular health. And in the United States, only 41% of children ages 12 to 19 have the 5 criteria for ideal cardiovascular health. What's worse is that only 16% of American adults have 5 or more metrics, that indicate ideal cardiovascular health. So those are scary numbers. The AHA's goal by 2020 is to, reduce the impact of cardiovascular disease by 20%. And, with diet, with exercise, with, paying attention to, what we're putting into our bodies and what we're doing, and how we're working our heart to keep it healthy. I think that's something that is attainable. Reducing heart disease and reducing strokes by 20% by 2020. So, thank you so much for your support so far. If you haven't contributed yet, please feel free to visit my fundraising page. It's listed at the bottom of this video screen. And if you're not able to give financially, please send your prayers and your good thoughts my way on March 18th as I walk in the American Heart Association's Heart Mini Marathon and take steps for strokes as well. So thank you very much. Good morning. Have a great Friday and a great weekend. Thanks again.